Ways out of teenage pornography addiction. This video is a comprehensive guide to recognizing and addressing porn addiction in teens. With the rise of digital access, teenagers today are more susceptible to porn addiction than ever before. This guide will help parents and guardians identify the symptoms of porn addiction in teens, understand its effects, and provide practical strategies to help teens overcome this challenge. Pornography addiction among teenagers is a growing concern with potential negative impacts on mental health, relationships, and personal development. Overcoming this addiction requires understanding its root causes, seeking support, and implementing practical strategies to regain control and build a healthier lifestyle. This guide provides actionable steps and resources to help teenagers break free from pornography addiction and develop positive habits for their future. Let us look at this issue by answering the following questions. What is teenage pornography addiction? Teenage pornography addiction refers to a condition where teenagers develop a compulsive habit of consuming pornographic material. This addiction can have several negative effects on their mental, emotional, and social well-being, including 1. Mental health issues, increased anxiety, depression, and stress. 2. Distorted views on sex, unrealistic expectations and misconceptions about sex and relationships. 3. Interference with daily life, neglect of responsibilities, academic performance, and social activities. 4. Relationship problems, difficulty forming and maintaining healthy relationships. 5. Desensitization, reduced sensitivity to normal sexual stimuli. Addressing teenage pornography addiction often involves education, counseling, and fostering open communication about the effects of pornography and healthy sexuality. B. What are the signs of teenage pornography addiction? Recognizing the signs of pornography addiction in teenagers is crucial for early intervention. Some common signs include 1. Excessive use, spending an increasing amount of time viewing pornography, often at the expense of other activities. 2. Preoccupation, frequently thinking about or craving pornography, even when engaged in other activities. 3. Secrecy and isolation, hiding their internet browsing history or using devices in private, avoiding social interactions or activities they once enjoyed. 4. Neglecting responsibilities, declining academic performance, missing school or assignments, and neglecting chores or responsibilities. 5. Emotional changes, displaying mood swings, increased irritability, anxiety, or depression, particularly if access to pornography is restricted. 6. Loss of interest in real-life relationships, showing diminished interest in real-life romantic or sexual relationships, struggling to form or maintain healthy relationships. 7. Tolerance, needing to view more extreme or varied content to achieve the same level of satisfaction. 8. Failed attempts to stop, trying and failing to reduce or stop viewing pornography despite wanting to do so. 9. Physical symptoms, experiencing sleep disturbances or fatigue due to late-night viewing sessions. 10. Compulsive behavior, feeling compelled to view pornography even in inappropriate settings or situations. If these signs are present, it may be helpful to have an open and supportive conversation with the teenager and consider seeking professional guidance. C. What are the causes of teenage pornography addiction? Teenage pornography addiction is a growing concern, driven by various interconnected factors. These include natural curiosity about sex, easy access to explicit material online, peer pressure, and the use of pornography as a coping mechanism for emotional issues. Insufficient sex education and unhealthy family dynamics can also contribute, as well as societal influences that either over-sexualize or stigmatize sexuality. Understanding these causes is crucial for developing effective prevention and intervention strategies. 1. Mental health issues, increased anxiety, depression, and stress. 2. Distorted views on sex, unrealistic expectations and misconceptions about sex and relationships. 3. interference with daily life, neglect of responsibilities, academic performance, and social activities. 4. Relationship problems, difficulty forming and maintaining healthy relationships. 5. Desensitization, reduced sensitivity to normal sexual stimuli. Addressing teenage pornography addiction often involves education, counseling, and fostering open communication about the effects of pornography and healthy sexuality.
D. What are the effects of teenage pornography addiction? Pornography addiction in teens can have significant negative impacts on school performance. Here are some key areas where it can affect academic life. 1. Decreased concentration and focus. Porn addiction often leads to a preoccupation with sexual content, making it difficult for teens to concentrate on their studies. Intrusive thoughts and urges can disrupt their ability to focus during classes and while doing homework. 2. Declining grades. As a result of decreased focus, teens may see a decline in their grades. The time and energy spent on consuming pornography can detract from time spent on studying and completing assignments. 3. Increased absenteeism. Teens struggling with porn addiction might start skipping classes or school altogether to engage in their addiction. This can lead to gaps in their learning and further impact their academic performance. 4. Sleep deprivation. Excessive consumption of pornography, especially late at night, can disrupt sleep patterns. Lack of sleep negatively affects cognitive functions, memory retention, and overall school performance. 5. Social withdrawal. Teens may withdraw from social interactions with peers and teachers, leading to isolation. Social withdrawal can affect group projects, class participation, and the development of important social skills. 6. Behavioral issues. Addiction can lead to mood swings, irritability, and behavioral changes. These issues can result in disciplinary problems at school, further impacting academic standing and relationships with educators and classmates. 7. Mental health problems. The guilt and shame associated with porn addiction can lead to anxiety and depression, which further impede academic performance. Mental health struggles can make it difficult for teens to engage in school activities and maintain motivation. 8. Reduced participation in extracurricular activities. Teens addicted to pornography might lose interest in extracurricular activities, which are important for a well-rounded education and college applications. Reduced participation can also limit opportunities for scholarships and social development. What are the parental roles for teenage pornography addiction? Parental guidance can play a crucial role in preventing and addressing teenage pornography addiction. Here are some tips for parents. 1. Open communication. Foster an environment where your teen feels comfortable discussing sensitive topics without fear of judgment. Talk openly about sex, relationships, and the potential harms of pornography. 2. Education. Provide accurate information about sex and relationships. Discuss the differences between real-life intimacy and the unrealistic portrayals in pornography. 3. Set boundaries. Establish clear rules regarding internet and device use. Use parental controls and monitoring software to limit access to inappropriate content.
4. Promote healthy activities. Encourage involvement in hobbies, sports, and social activities to reduce idle time and opportunities to seek out pornography. 5. Model healthy behavior. Demonstrate respectful and healthy attitudes towards sex and relationships in your own behavior. Avoid making jokes or comments that trivialize or sexualize others. 6. Monitor and supervise. Be aware of your teen's online activities and who they interact with online. Regularly check in on their emotional well-being and offer support. 7. Encourage critical thinking. Teach your teen to critically evaluate media and question the messages they receive about sex and relationships. 8. Seek professional help. If you suspect your teen has a pornography addiction, consider seeking help from a counselor or therapist who specializes in this area. By maintaining an open and supportive relationship, parents can help guide their teenagers towards healthy behaviors and prevent the potential harms of pornography addiction. F. What are the practical ways out of teenage pornography addiction? Treating teenage pornography addiction often involves a combination of strategies aimed at addressing the underlying causes, reducing consumption, and promoting healthier behaviors. Here are some effective treatment options. 1. Professional counseling. Individual therapy. A therapist can help the teenager understand the root causes of their addiction and develop coping strategies. 2. Cognitive behavioral therapy (CBT). CBT can help change negative thought patterns and behaviors associated with pornography addiction. 3. Family therapy. Involving the family can improve communication and support systems. 4. Support groups. Joining support groups, either in person or online, can provide a sense of community and shared experiences. Groups like Sex Addicts Anonymous offer programs specifically for teenagers. 5. Parental involvement. Open and honest communication about the addiction, providing support and understanding without judgment. 6. Education and awareness. Educating the teenager about the impact of pornography on the brain and relationships. Promoting critical thinking about the unrealistic portrayals of sex in pornography. 7. Healthy alternatives. Encouraging participation in hobbies, sports, and social activities to reduce idle time and focus on positive interests. Promoting mindfulness practices, such as meditation and yoga, to manage stress and emotional triggers. 8. Digital management. Implementing parental controls and monitoring software to limit access to pornographic content. Setting clear boundaries and guidelines for internet and device use.
9. Developing coping mechanisms. Teaching healthy coping mechanisms for dealing with stress, loneliness, and other emotional challenges. Techniques such as journaling, exercise, and engaging in creative activities can be beneficial. 10. Setting realistic goals. Helping the teenager set realistic and achievable goals for reducing and eventually eliminating pornography use. Celebrating progress and milestones along the way. 11. Medication. In some cases, medication may be prescribed to address underlying mental health issues such as anxiety or depression that contribute to the addiction. 12. Consistent support. Providing ongoing support and encouragement to reinforce positive changes. Being patient and understanding that overcoming addiction is a gradual process. Combining these approaches can create a comprehensive treatment plan tailored to the teenager's specific needs, fostering a healthier lifestyle and reducing dependence on pornography. G. What are the preventive measures for teenage pornography addiction? Preventing teenage pornography addiction involves proactive strategies that educate and guide teenagers towards healthy behaviors and attitudes. Here are some effective prevention tips. 1. Open communication. Foster a home environment where open, honest discussions about sex, relationships, and media are encouraged. Address questions about sexuality and pornography in an age-appropriate, non-judgmental manner. 2. Comprehensive sex education. Provide thorough education about human sexuality, emphasizing respect, consent, and healthy relationships. Highlight the differences between real-life intimacy and the often unrealistic portrayals in pornography. 3. Parental controls and monitoring. Use parental control software to restrict access to pornographic websites and monitor internet use. Set rules and guidelines for device use, including where and when devices can be used. 4. Encourage healthy interests. Promote involvement in extracurricular activities, sports, and hobbies to keep teens engaged and reduce idle time. Encourage social interactions and building healthy friendships. 5. Model healthy behavior. Demonstrate respectful and healthy attitudes towards sex and relationships. Avoid making inappropriate jokes or comments that trivialize sex or objectify others. 6. Digital literacy. Teach teens about responsible internet use and the potential risks associated with consuming online content. Encourage critical thinking about the media they consume and the messages it conveys. 7. Emotional support. Be attentive to your teens' emotional needs and provide support during difficult times. Teach healthy coping mechanisms for dealing with stress, anxiety, and other emotional challenges.
8. Set clear boundaries. Establish and communicate clear expectations and rules regarding internet use and consumption of media. Be consistent in enforcing these rules while also allowing for open discussion about them. 9. Promote self-esteem and confidence. Encourage activities and interests that build self-esteem and a positive self-image. Reinforce their worth and value outside of appearance and sexual appeal. 10. Provide resources. Make educational resources available that discuss the impacts of pornography and healthy sexuality. Offer books, websites, and programs that align with your family's values and provide accurate information. By implementing these strategies, parents can help their teenagers develop a healthy relationship with technology and media, and guide them towards making informed, respectful decisions regarding their sexuality.